Several videos have gone viral on social media, continue to do so, of people talking about leaving traditional insurance behind and instead switching to direct primary care. So what is that? How is it different from what we're all used to? Dr. Matthew Else is a physician at Concierge, the medical director over there near 71st and Sheridan, which is a direct primary care facility. Thank you for joining us, Dr. Else.
Thanks for having me.
So what do you do? How does what you do work at Concierge?
I mean, I need a long time to talk about that,
Yeah.
but very simply, it's everything you understand your primary care to be, but it tends to be more affordable and you get longer time with your doctor and better results.
So how do people sign up for direct primary care?
Yeah, most direct primary cares have a membership either monthly or annually, and it ends up being about $100 or less a month. And that typically covers unlimited visits, unlimited communications with the doctor, either included labs or cheap labs. For instance, on our membership, our middle plan includes unlimited imaging like MRI, ultrasound, CT, X-ray. It's pretty amazing what you can do when you leave the insurance out of it.
So CT, X-ray, tell us about some of those other things that people not realize. It's not just a checkup if you're trying to do this and trying to get rid of your insurance.
Yeah, I absolutely love it. It's what's unique about my specific practice. Not all direct primary cares can have this in their facility, but they tend to have agreements for it. But there are times where someone comes in and they are thinking they're going to have to go to the ER, but instead they come in and I can do a scan. I can walk them down out of my office down to the scan and check to see what's going on, to prevent them from going to the ER, to take the next step, to avoid those big bills, and most of the time it's included in their membership.
And that is my question. So if somebody does have to go to the ER, if there's like surgery involved, is that then out of pocket?
Yeah, so it's generally a good idea to have insurance for what it used to be, for something catastrophic. You don't take your car insurance and go to the mechanic and ask for an oil change. We do those, we pay cash for that. So your insurance should be very much the same. You should save it for an absolute emergency, and then if you pay cash for everything else in between, the prices are much more affordable. You can get better care. It's a lot easier.
And I can't speak for everybody out there, but I know $100 a month would undercut what I pay for insurance a month for sure, and a lot of times it's checkup. So I have to ask, what do people tell you? Is there kind of hesitance at first? Like, oh, I don't know, like ditching insurance. Like insurance is a safety net. That's the name, that's the word, insurance. Yeah. You're insured.
Yeah, you can still keep that insurance like I was saying, and most people just feel like it's too good to be true. But every time that I bring them in, as I walk through the benefits, once they experience it for themselves, their mind is blown. It takes us back to what medicine used to be, when you used to be able to spend time with your doctor. Our visits are 45 minutes long for most cases, sometimes 30, and for new patients, an hour or more. So it's getting personal with your doctor again. They're going to know everything about you. They want to know about your family. It feels good.
And I'm curious about this because as a parent of two pretty small children, I always say small children, they're 7 and 5, they're not really small anymore. But as a parent of 2 children, I just want to call a doctor sometimes. And you're saying, so if you do the direct primary care monthly, you can call a doctor and say, hey, is this something?
Yeah.
Because that's got to be a question you get all the time. Is this something?
All the time. We have an app where you can just text us a picture, say, hey, my kid has this rash, what's going on here? We can bring you in. Yesterday I had a new patient. They would have had to wait multiple weeks at a traditional office. I brought them in the same day because they told us what rash was going on, and I knew that I needed to treat it immediately. So you're able to communicate quickly. You're not waiting 3 days for a reply from an office.
Interesting, interesting. I did want to ask about, so you were in the traditional medicine for several years. So how do you see a difference in a doctor's perspective and how you can relate to patients?
I'm so proud. I was proud of what I used to do. I'm even more proud now because I know I'm taking amazing care of people. I can take time. I can build a relationship with them. I don't feel like I'm rushing them out the door. It's just an overall better experience.
So if someone were to, let's just say, come in with something that really needed serious attention, like right away, like they're coming in, you're like, you need to go here. How does that typically work? Like referrals? Yeah. Like if somebody does come to you and it's like, hey, you really need to go to an emergency room or surgery maybe.
It's almost identical to what you'd experienced before. I had a case of this, a gentleman in his 40s. I did a scan on his heart and it was very, very severely blocked. I got him in with the heart doctor within a week and he had a stent placed and he's much better health now. It's something I never would have been able to order at my old job. The insurance would have held it up. It would have taken months. I did it the same day, got the referral in. He was in next week and had a stent placed.
Same thing with like an appendix. Hey, I'm kind of hurting here. it could be the same thing where you could be able to potentially scan that person with an appendix and say, hey, this thing is going to burst. We need to get this done.
We'll know more urgently what's going on. The cost of that scan at our facility is going to be a tenth of what you're going to pay at the ER. Everything at the ER is more expensive. So it might end in the same result where you have to have surgery, but we knocked that bill down significantly and helped you coordinate to get in quickly.
Direct primary care. Very interesting, Dr. Else. This has been an eye-opening conversation, and I appreciate your time.
Thank you.